You've probably heard of repetitive use injuries in orthopedics, and I believe that that's an important principle that is relevant in orthopedic care. However, I have two qualms with that idea. One, people always talk about repetitive use injuries, or almost always, in relationship to muscle and tendon pathology. And while that certainly occurs, I find clinically that most repetitive use injuries have to do with a problem mechanically in a joint. And most people are not actively using their muscles and tendons on a very regular basis to the point that it would cause pathology, but they are using joints every day to make daily movements and repetitively moving often in the same direction. So that's why I find there can be repetitive use injuries in joints for many patients. Secondly, I think there's a lot of repetitive positioning injuries or pathology, or maybe you can call it repetitive disuse, but that is, the use is not active or passive movement, but rather a sustained position. The one that I see most commonly is that repetitive use of a position of sustained flexion of the lumbar spine and neck in sitting can cause people problems. So when you think about repetitive use, think about this broader picture.